Hello, I'm Lorena Drago. Are you taking medication for your diabetes? If so, you're not alone. Everyone with type 1 diabetes needs insulin. Many people with type 2 diabetes use some form of medication as well. In this video, we'll discuss the different types of diabetes medications. First, some things you should know about their importance. If you were recently diagnosed with diabetes, you may be hoping to control it with diet and exercise. Many people are able to do this. But if you were prescribed medication because your blood sugar levels are high, you shouldn't hesitate to take it. High blood sugar can lead to serious complications such as eye, nerve, and kidney disease. To prevent these complications or stop their progression, you may need medication. If you can't control your blood sugars with diet and exercise alone, don't feel that you failed. Type 2 diabetes is a chronic condition that happens gradually, not at once, and it tends to get worse over time. The longer you have type 2 diabetes, the more likely you'll need medication to control your blood sugar and protect your health. There are three main types of diabetes medications: oral, insulin, and injectables. Oral medications include dozens of brand name and generic drugs. For people with type 2 diabetes who take oral medications, metformin is the most commonly prescribed. Insulin, which has worked well for decades, is still widely prescribed, not just for type 1 diabetes, but also in many cases for type 2. Insulin is typically injected, and then there are certain medications beside insulin that are also injected. Diabetes drugs work on the body in different ways. For example, insulin is prescribed if your body doesn't produce any or enough insulin on its own. Some oral medications stimulate the pancreas to produce more insulin. Others help your body use the insulin it makes more efficiently. And others inhibit the amount of glucose your liver makes, so less insulin is needed. Because these drugs help to manage diabetes in a variety of ways, one may be given in combination with another, sometimes at different times of the day. It's important to take them at the right time of day as prescribed. Unlike previous years, when there were only a few options for treating diabetes, treatment can now be individualized for your specific situation and fine-tuned for greater effectiveness. Your drug therapy may differ substantially from that of another person you know or even a family member. Your healthcare provider will work with you to determine the treatment plan that is most effective for you. In a moment, we'll take a closer look at insulin and insulin delivery methods. But first, let's pause for a brief quiz to help you remember some important facts. People with type 1 diabetes and many with type 2 diabetes use insulin every day to control their blood sugar. The two most commonly used types are rapid-acting and long-acting. Rapid-acting insulin is meant to be injected right before you eat to control the rise in blood sugar that can happen after a meal. Rapid-acting insulin can also be taken to correct a high blood sugar level. It begins to work very soon after you take it and lasts for just a few hours. Long-acting insulin is meant to help control your blood sugar level over long periods of time. Did you know that your body needs insulin 24 hours a day, even if you never ate any food? Long-acting insulins take the place of the insulin that your body would normally produce throughout the day. Long-acting insulin begins to work about 1 to 2 hours after you inject it and can last somewhere between 12 and 24 hours. Most people who use long-acting insulin take it once a day, but it can also be used twice a day. There are also pre-mixed insulins. Pre-mixed insulins have the effect of two kinds of insulin. One that works quickly and one that lasts longer. Now let's look at insulin delivery methods. Syringes are by far the most common way people get their insulin dose. Fortunately, the days of sharpening needles and boiling glass syringes are behind us. Modern plastic syringes are small, lightweight, easy to use, and disposable. Another way to get insulin is an insulin pen. Insulin pens look a lot like regular pens, except that under their cap is a small needle instead of a ballpoint. Pens come preloaded with multiple doses of whatever insulin your doctor has prescribed. To inject yourself, you dial in the appropriate dose, penetrate the skin, and press the button. A third popular insulin delivery system, mostly used by people with type 1 diabetes, is the insulin pump. Pumps are small electronic devices about the size of a deck of cards that deliver a continuous flow of insulin to your body. The dosing occurs in two ways. A continuous drip enters the body at a preset dose, but you can also release a larger dose before meals or when your blood sugar is too high. A pump reservoir holds a supply of insulin that lasts for several days. One benefit of some insulin regimens is that you can learn to vary the dose to suit your activity level or diet. As we have seen, there are many medications available to help you manage your diabetes. A certified diabetes educator can help you to understand your treatment plan, how to use your supplies, and work with you on your dosing routine. Be sure that you know the name of each medication you've been prescribed, the dose you should take, when you should take it relative to your food intake, what to do if you miss a dose, and what other medicines, foods, or drinks you should avoid while taking your diabetes medication. It is also important to remember to keep a paper or digital diary to help your healthcare team adjust your treatment. Record your activities and blood glucose levels every day, and don't forget to bring these records to your medical appointments so you can review them with your providers. While scientists continue their search for a cure, they are also continuously searching for better medications to improve the treatment of diabetes. Thanks in large part to these advances, diabetes treatment is easier, safer, and more effective than ever. Remember, medication is just one tool in your diabetes self-management toolbox. It should be part of a treatment plan that also includes a healthy diet and physical activity. I'm Lorena Drago.